It's important for men to realize that sexual wellness is men's wellness. How you take care of your body and the decisions you make that impact your total health span will impact your sexual wellness as well. Oftentimes, men think that how they perform is the best it's going to get. This is who they are, how long they last, how strong their erections are. If a man doesn't have an issue that they think is a problem, it doesn't mean they can't educate themselves. It doesn't mean they can't experiment and become better in the bedroom for both them and their partner.
Thanks for being with us today. I want to start out by asking you, what is your 30-second origin story? How did you find your way into men's health and wellness? And when did you realize this is my specialty?
I started as a urologist, and like most urologists, I wanted to take care of cancer. And what I realized is one of the side effects of a lot of the cancer treatments is, men's wellness, sexual wellness issues like erectile dysfunction or testosterone issues. And I noticed that those men were often having those complications and things that happen to them neglected. As I progressed my practice outside of cancer treatment, I began to focus on the aftermath of cancer treatment and survivorship. And so that led me down the pathway of men's health and men's wellness. And it has blossomed into my career with a real focus on all types of men's wellness.
For anybody watching this and they're curious, what is male factor infertility? What are some examples of things that could happen?
Most people, when they think about infertility, unfortunately think it's the female problem and that it's all the women's thought. And what we know is that's not the truth, that over 50% of times that a couple is having difficulty with fertility, the male is involved to some degree. And that has to do with sperm health. And what we're seeing nowadays is a crisis of sperm health and fertility rates around the world. The numbers are down almost 50% since 1970. And it's a crisis related to our diet, exercise, our food sources, chemicals in our environment, and overall wellness. And so what we're seeing is the quality and the quantity of sperm in men these days is not as good as it was decades ago.
What does that mean to have low quality sperm?
When you look at sperm under the microscope, you're looking at millions and millions of swimmers or sperm. And we want to know not only are they healthy, but can they swim? Can they swim in the right direction? Are they healthy sperm? Are their heads and their tails healthy? And when we put that all together, it's called a semen analysis study. And that tells us how fertile a man is. And all of the factors about a man's lifestyle, their genetics, previous medical conditions, surgeries, their lifestyle, their diet, they all come into play over the first 18 to 35 years of life, leading to the health of a sperm. And so when we look at a sperm sample under the microscope, we can really determine how healthy that man is based upon how healthy their sperm is.
The couple is trying to conceive. What would be a good time frame if they're not having any luck? When should they see somebody? When should the man see a urologist? When should the woman see a fertility specialist? Are we talking months, a year? What do you think?
Well, sooner rather than later. However, all couples will experience some difficulty with achieving pregnancy. And it's not abnormal for couples to take a few cycles with the female, 3 months, 6 months to achieve it. But if you're having difficulty achieving and it's been 6 months to a year, it's not unreasonable for the female to see her OBGYN and for the male to see his urologist to get a workup. Now, the one caveat to that is age, right? So if you're an older couple, we don't want to wait too long. So if you're getting into your mid to late 30s, early 40s, and you're having difficulty, then right away is the right time to see your practitioner.
What should young men know about sperm health? You're in your early 20s and you're like, okay, maybe I don't want a family right now, but I think I will in the future. What are some things young men should know?
I always say sperm health is a real test of your overall wellness. How healthy your sperm are is indicative of how healthy you are. It takes a sperm around 70 to 75 days to mature. What you do 90 days before trying to have a baby will impact your sperm. I tell all my patients there are simple things they can do for their overall wellness that will have a dramatic impact onto their sperm health. Quitting smoking, limiting alcohol are always a good idea. Eating healthy, exercising are critical to sperm health. And the last is there are certain things that your sperm needs in order to be healthy, certain minerals and vitamins. And so taking a supplement is important for sperm health, can help those process, especially if you take that 90 days before. What we see a lot of times is that men are planning IVF. Men have something on the horizon, military service, or maybe a cancer diagnosis that's going to require them to take chemotherapy, oftentimes prior to IVF, but also prior to sperm banking. For various reasons, we'll see men adopt a very healthy lifestyle 3 months to 6 months prior to that event, and they can do all these things to help their sperm get healthier.
I hear a lot about women freezing their eggs for later in life. That's something common that men do. Do they bank their sperm at a young age in their 20s to be used later on?
We didn't talk about this often. We only talked about sperm banking in a certain population. And a lot of times that was men who were staring down a very serious diagnosis that could render them infertile. And so if they were going to get surgery or radiation or chemotherapy, they would bank their sperm and anticipating that they may not be have children in the future. That paradigm shifted. And we're seeing a whole population, a whole generation recognize that as they get older and their exposures to plastics and an unhealthy diet is causing their sperm health to go down, they're banking their sperm early in life because that's their healthiest sperm so that they can use it in the future if they want to, if they choose to, or if they need to.
What is one trend in this industry or just in men's health in general that genuinely excites you?
One of the biggest things that we see is premature ejaculation. It has long been the biggest issue in men's sexual wellness. And so lasting longer is the holy grail for men. You'll never meet a man who doesn't want to last longer in bed. And what we're seeing is that some of the products on the market are allowing men to last longer without needing to take medicines, without needing to stress about it. I'm talking about delay sprays. But what has been most important and most exciting for me is as we're seeing these men last longer, we're seeing increase in confidence and satisfaction in the bedroom, but we're also seeing partner satisfaction increase and orgasm rate amongst women double or triple. That sort of treating two patients and making two patients happy is really an exciting concept.
Absolutely. Oh, that's fantastic. Now, if you could teach the world one key insight about this field, something that really moves the needle, what would it be?
The whole idea of wellness, health span, and lifespan is hot right now. Longevity medicine is all the rage. It's important for men to realize that sexual wellness is men's wellness. How you take care of your body, what you put in your body, how you exercise, and the decisions you make that impact your total health span will impact your sexual wellness as well. The other thing that I think is incredibly important is for most men to understand that they can be better in the bedroom. Oftentimes men think that how they perform is the best it's going to get. This is who they are, how long they last, how strong their erections are. If a man doesn't have an issue that they think is a problem, it doesn't mean they can't educate themselves. It doesn't mean they can't experiment and become better in the bedroom for both them and their partner.
Now, at Shaw, we train many people who are wanting to work in men's health. What's the most important thing professionals need to know about male factor infertility?
I think the most important thing is that it's a scary time for a man, and that oftentimes men look at it as this is a definition of their manhood and who they are. It can be incredibly humbling and almost terrifying for men to be facing a diagnosis that their testicles don't produce sperm, their sperm aren't good enough. And that's a very emotional environment to be in. And so for me, the first thing and the most critical thing is to maintain a relationship with that person, make sure that the emotional needs of the patient are met, and make sure they know that not only are there options for the workup and the diagnosis and figuring out what is exactly happening, but there's a lot that we can do in order to treat you.
Yes, I totally agree with that. My last question for you, if you could leave one message for the next generation about men's health, what would it be and why does it matter right now?
It was frustrating for a long period of time to see sexual wellness and men's health neglected. I look at men's health just like I look at high blood pressure and diabetes and high cholesterol. Bringing the conversation out of the bedroom into the mainstream is absolutely critical so that all people, no matter where they are or no matter who they are, understand that their journey matters and that sexual wellness is important and that their specific situation deserves the attention that it's not getting if it's not getting it by their current providers.
Absolutely.